The Medicare annual election period is rapidly approaching as it goes from October 15th until December 7th. This is the time of year where you always want to double check your Part D prescription coverage and make sure you have the right plan going into 2023. But how do you do it? Well, we'll tell you today. So the first thing you'll want to do when doing a Part D review is you go to Medicare.gov, which is the official website for the federal government for Medicare. Now we want to show you how to do this because we often have people ask us how to do Part D reviews to look at new options for next year. We do only conduct these for our current clients or people that are looking to become a client with a Medicare supplement plan, but we wanted to show you exactly what we do so you have the tools to be able to do this yourself. So once you're on Medicare.gov, you can go to where it says Preview 2023 Plans in the upper left here. Or if the view of this changes, because sometimes this will change throughout the open enrollment period, you can go to Find Health and Drug Plans as well and click Find Plans Now. So again, you'll go here, click on it, and this will take you to where you start to do the review process. Keep in mind that the annual election period, it goes from October 15th until December 7th. That is when you can actually make a change in your enrollment for next year, and the plan will be effective January 1st. However, you can start looking at plans now, and that does begin October 1st, which has just passed. So what you'll do is you'll put in your zip code. We'll just use ours as an example. And what you'll do is you'll select drug plan. You don't have to pick where it says Part D plus Medigap. That's really unnecessary in this case because, again, all we're doing in this video is showing how to do a Part D prescription drug plan review. So do that, apply, and start. Now make sure it does say 2023 here because you'll be looking at upcoming years. Now if you know you get any assistance like LIS, which is low income subsidy, also known as extra help, you can click this if you get Medicaid. But for now, we'll just say I don't get help from any of these programs since that is typically the most common, and then you'll click next. At this point, if you don't have any prescriptions, you can put no here and it will basically just take you to the lowest overall drug plan for next year, but we'll assume you are using this to compare some medications. So you'll click yes and next. Now at this point, you'll want to have all of your medications handy, whether you have a list of it or you have all your bottles of pills and other medications, just make sure you have those in front of you. And what you'll do is you'll just start typing in what you have. So we'll do a couple examples here. And notice that when I start to type in a medication, it will pull up a list of all the suggested names. So you don't have to type in the full prescription, but for this one, I'm looking for specifically metoprolol succinate. And if it's tartrate, you want to pick that one. So be very clear that you're picking exactly what it says on your prescription. Don't assume these are going to be the same medication or the same price. So we'll do succinate, add drug. And then here is where you pick the dosage, the quantity, and the frequency. So the dosage is the strength basically. So we'll say it is a 50 milligram tablet. And the quantity in this case is 60 every month. So this is assuming that you take this prescription 2 times per day and you're filling it monthly. Now let's say we want to change this though. And we say you get 90 tablets, but you get it every 3 months. So you get one tablet or you take one tablet per day and you get a 90-day supply. So you can adjust this however you see fit and what you actually use for your prescription and then do add to my drug list. Now at this point, you'll just keep adding prescriptions and until you're done, then you'll do done adding drugs. Now if all of a sudden you realize that your metoprolol is actually 20 milligrams, you can go back in, you can edit this, change it to 20, keep the frequency, and update it. If you have to remove it entirely, just click remove drug. So I'll do a couple more examples here. So we will do Advair, which is a type of inhaler. And when I do that, add drug. So it will prompt you if you have a generic. Make sure you're actually taking the generic. If that is the case, you can click add generic. However, in this case, we'll assume you do take the brand Advair and you can add the brand instead. So this is where it gets a little tricky for the dosage sometimes because you'll have the inhaler right here and then the package. So you get a pack of 60 of these. So you're taking 2 a day. But some people will say, well, I take 60 different powders, so I do 60 every month, but that's wrong. That is saying you're getting 60 inhalers per month, which is way overestimating it. So again, this is saying you are getting 1 pack of 60 every month, which is more accurate. And we'll do one more. A lot of people take Synthroid. However, a lot of people take the generic. So this is where you would put the generic version, which is levothyroxine. And you do add generic, it will take you there. Again, you always want to make sure you're doing tablets versus capsules. Whatever you take is what you'll put. So in this case, tablets are most common. I will put a tablet. And again, we'll do a 90-day supply. So 90 tablets every 3 months. Add to my drug list. So at this point, we'll assume your drug list is complete. If you need to print it, you can always do that. You can print it and you can save it as a PDF. You go to save as PDF or however it is on your computer. Now again, double check your list and then done adding drugs. And this is where you're going to choose your pharmacy. The reason this is important is because every Part D plan will have a different network of pharmacies. Some will be preferred pharmacies, some will be standard pharmacies, and some may even be out of network. So you want to make sure that the pharmacy you're specifically planning on using works for the plan that you're choosing. So what we'll do here, if you want to just find the lowest cost option for the pharmacies, I'll show you a pretty cool trick shortly, but we'll assume you want to actually pick the pharmacies you truly plan on using. So let's say you're open to mail order and you are open to Walgreens and CVS, but you really don't want to try other ones. So you can choose those right down here. They'll pop up on this list. You can do up to 5 pharmacies at a time. And if you don't want to do any of those, let's say you just want to search for one you know you use. Let's assume Costco. You can do that. You can type in the name, click find pharmacy, and then the whole list of Costco's in your area will pop up. So we will add Costco. Let me go back, exit out. And if you click it with nothing in the name, it will show you all the pharmacies in your area again. So now we'll do Costco, Walgreens, and let's just say mail order. So once you're done picking your pharmacies, we'll click done. And this is where it will take you to a full list of all of the plans in your area as far as Part D plans go, and it will rank them from the lowest overall cost, essentially to the highest overall cost. Now, if for some reason you do want to look at Medicare Advantage plans, you can do that by looking in this upper right-hand corner. If you click View Medicare Advantage plans, it will change it to those. Again, this is strictly a Part D video, so we'll keep it focused on that. You want to make sure that it does not say you're looking at 2022 plans because we are looking at coverage for January 1st. So at this point, again, it will show you a list of the plans. There's 24 different plans in our area, and it will sort it automatically from lowest, drug, and premium cost. So this is very important. There's other options here like lowest deductible and lowest premium, but neither of those should be selected. You should always pick lowest drug and premium cost. And once you have selected that, again, it sorts it by this number right here. So these numbers are showing the all-in price for what you'll pay for the premium. So again, this is $28.20 per month to have this plan in place. So you pay that and you pay for your prescriptions when you fill them at the pharmacy. And that is what this number is showing. So this does take into account the deductible, everything that you're estimated to spend throughout the year for your prescriptions that we specifically entered will be reflected in this number. So as you go down, this number will keep creeping up. And you really want to pick a plan that has one of the lowest overall estimated costs for both the drugs and the premiums. Don't worry about the deductible. Don't worry about a lot of other factors. You're simply looking at this number. So as we scroll down, you'll just keep seeing again, there's more plans. It keeps increasing in price. But what we'll do now is we'll go up to the top one. And this is where you'll do plan details. So you can look at the plan details and you can see more details about what it's actually covering for you and your medications. So right here, it will tell you if all of your medications are covered. This one does cover 3 of 3 medications, which is all of the ones we entered. That means they are all listed on the plan's formulary. It does not mean they cover them at no cost to you. So just keep that in mind when you're looking at these details. So as we scroll down, again, you'll see here, if you use Costco or Walgreens, Costco is an out-of-network pharmacy. So if you want to choose this plan, you definitely do not want to use Costco, or you can't use Costco because it's not a network pharmacy. However, if you're open to Walgreens or mail order, this could still work for you. So it's really important you pick the actual pharmacy that you plan on using, because if you do this analysis, you only pick Walgreens, but you actually plan on going to Costco, you're not going to get an accurate list of what this will look like for you. So as we keep scrolling down, it will break it down for each pharmacy, mail order. You don't need to know all of this. If you are curious about the donut hole, a lot of people say, will I hit the donut hole? It will actually project if you might hit it. So in this case, with these medications, if you go to Walgreens, you are projected to hit the donut hole in December of next year, and even a little bit sooner with mail order in October. So a couple other things to look at here. You're just going to scroll down. This breaks it down by each pharmacy. And you can see here, Costco is out of network, so you pay the full price. Even the retail cost is $463. You're paying that no matter what phase of drug coverage you're in. So you definitely do not want to use this plan, again, with Costco. Now we keep going. You can click view more drug coverage. So you always want to keep scrolling down, double checking everything. This is where you'll see the different tiers of medications. So this is basically saying how each medication is covered and what the price is. So this will show you your specific medication tiers. So Advair in this case is the highest tier medication. It is a tier 3 medication, which you can see here. This is tier 1, tier 2, and tier 3. So after your deductible, you can expect Advair should have a $40 copay for a 1-month supply, and you can triple that for a 90-day supply. Now, the last thing you'll want to check here, there's prior authorization, there's quantity limits, and there is step therapy. So quantity limits are basically saying you can get this amount of the medication per this amount of time. So if you click on that where it says yes, it will actually show you the quantity limit of a medication. So this one, you can get 60 every 30 days. And again, 60 is basically that disposable pack of 60. So this fits the quantity limit because again, we are getting 60 1 month. So 60 every 30 days. Now, step therapy is more complex. Less medications will have step therapy, but if it says yes here at all, make sure you understand what that means. It is basically the insurance company telling you, we may not cover this medication or we likely won't cover it until you try another alternative version of that medication if you have not already. Prior authorization is somewhat similar, but that is basically saying your doctor will have to submit to the plan that it's medically necessary for you to take this prescription. So if none of these say yes, that means they do not have prior authorization or step therapy, and you can see here Advair is the only one with a quantity limit. So those are all the plan details. We go into those in more detail in this video, but again, you're really just looking at the overall cost. So as long as there's no step therapy, no restrictions that are bad for you, and you plan on using Walgreens, you essentially choose the top plan right here. Now, if you want to consider other ones like this one with this plan, you can again go to the details. Now, this one includes Costco and Walgreens. So if you do prefer Costco, you might want to switch to this one instead. So again, we don't want to go too much into detail into reading the analysis. You're really looking at the overall cost here, but I do want to mention that trick when it comes to finding different pharmacy prices. So what we'll do here, actually I'll go to WellCare on this. So go to plan details, and this is brand new. So this is a really cool feature that Medicare.gov just added, and you go to change pharmacies right in this little drug coverage section. So change pharmacies, and it's going to show you projected costs at each pharmacy before you even select it, and it will show you which one's preferred. So again, you can see right here, okay, CVS is preferred and it's a similar cost to Walgreens. So you're looking at $1,164 to $1,182. So you can keep scrolling down and you can see, is there anything that seems to be lower than Walgreens or similar that you want to go to? Maybe you want to go to Kroger. You can add that here and you just keep going until you find pharmacies and plans that you're open to. So with that being said, we'll click done, go back to the drug coverage. It will add it to that list automatically now that we selected it. So we'll go back. And again, that was showing the specific pharmacies with WellCare. So if we do that with this AARP plan, change pharmacies, you're going to see different ones. So now CVS is not preferred. So again, if it does not say preferred, that means it's a standard pharmacy, which typically means the costs are higher, which is reflected here with $937 versus roughly $1,300. So that's most of the things you need to know about the drug plan analysis. Of course, if you have questions, please leave them in the comments of this video. We cannot do the analysis for you unless you're a client of ours, but this is exactly what we do for our clients. So you should be able to use these tools to find what's right for you. And one quick thing to mention is that if you are taking insulin, you may have seen our other video about the Inflation Reduction Act. If you have not already done so, please watch that. You'll have to see some big changes coming to Medicare, especially with insulin in 2023. But if you are taking insulin, Medicare.gov is not going to accurately reflect those numbers until probably after the annual election period. Remember, that bill was passed before they got all the data on here. So a lot of times you'll see insulin is overestimated using this analysis because any insulin that is covered by a plan on the formulary should be capped at $35 for a 1-month supply. So if you see any number above $35 and the insulin is covered, just know that it is not accurately reflecting the price. Quick example showing how the insulin coverage is not accurate for now on Medicare.gov. So you can see here Toujeo is a type of insulin. It is a tier 3 medication on this plan, so it is covered by the plan. It is on the formulary. However, when I go to see the cost for it, you'll see Toujeo right here. It's saying you're going to have to pay about $438 during the deductible and $47 per month after that. However, all of these numbers should say $35 across the board. So again, keep that in mind, and if you have any questions specifically, put them in the comments below.